The most common complication of influenza is secondary bacterial pneumonia. You should suspect this in any patient who is developing a worsening fever and pulmonary symptoms. This includes dyspnea or productive cough after initially improving symptomatically. There are criteria for adults that are high risk for influenza complications. Number 1 is if the person is aged more than 65 years old. Number 2 are women who are pregnant and up to 2 weeks postpartum. Number 3, underlying chronic medical illnesses like chronic pulmonary, cardiovascular, renal, or hepatic problems. Number 4 is immunocompromised patients. Number 5 is morbidly obese patients. And number 6, residents of nursing homes or long-term care facilities. The two most common causes are Streptococcus pneumonia and Staph aureus. When it is Staph aureus, the symptoms tend to be much more severe, necrotizing, and rapidly progressive. The patients will often have very high fever. They might even be hypotensive. They'll have dyspnea, hemoptysis, and even confusion. On chest x-ray, there will be no cavitation, but you will see lobar or multi-lobar infiltrates. These patients usually require a treatment in the intensive care unit, and they are started on multiple broad-spectrum, even empiric antibiotics like vancomycin, piptazo, and levofloxacin. The mortality rate is very high. It's up to 55%. There's obviously other causes of pneumonia. For example, Klebsiella often causes pulmonary infections, especially those who are at risk for aspiration, like alcoholics. Legionella also causes a high fever, but remember that prominent gastrointestinal symptoms like vomiting or diarrhea is a big giveaway. If we're talking about mycoplasma pneumonia, this causes indolent, which means that the symptoms are not acute. So these patients might just present with a headache, maybe malaise, a non-productive cough, and low-grade fever. Another big one is Pseudomonas pneumonia. This is nosocomial and is a lot less likely to develop after someone having influenza in the community setting.